I started looking for it. I could not find it anywhere. It's not taught in medical schools. It's not on any of the literature from the standard medical literature. But I found the article. Eventually, I found it in 1965. There was a doctor who reported 92 cases of bloating, of abdominal distension. And these are people who are saying, I feel like I'm pregnant. I feel like my stomach is pushing out, and like I can't put any more every time I eat. And it doesn't matter what I eat, well, no matter what goes in there, and it just bloats out. And so immediately I got to stop eating. But I know it's not an intestinal problem, because my patient, at least, didn't lose weight. She was still overweight. So she's overeating in spite of not being able to eat at all. So it's not an intestinal problem. It's not like SIBO, inflammatory bowel disease. And she'd been tested for all those and treated for all those and all this stuff. So I found this one report from 1965. And it's the only thing ever written on the subject, except that one little thing from England that I found. Couldn't find it anywhere else. And it turns out that you have muscles that maintain your intestines. So your intestines are like in a bag, like they're a bag of snakes, and they could just move around freely, except for the one place where they're attached to the blood vessel, and everything else, they just kind of move over each other. Your intestines move around all the time. And you put your hand on your belly, sometimes you can feel them going underneath there. And they're in a bag. But the bag doesn't have any structure to it. It's just like, it's a bag. And so the structure comes from those muscles. And there's muscles all the way around, and there's muscles on the top and muscles on the bottom. And that all holds everything together. They call it the abdominal canister. Now, in medical school, I never heard of the abdominal canister. This is like a totally new concept to me. So this is like physical therapists talk about this. It's not like in medicine. So this woman who'd been treated for, my patient, I think like 3 years, and she'd taken all these antibiotics and diets and all this crazy stuff the pills that she's popping and herbs and all this stuff. And it turned out that it was so simple. The problem is a spasm. So you have these muscles on the top called the diaphragm, on the bottom called the pelvic floor muscles. And when they spasm, they shorten the canister, and everything pushes out. And so that's why everything pushes out. And that's what the bloating is. It's just a spasm of muscles. It's an abnormal reflex. You have a normal reflex where those muscles, the diaphragm and the pelvic floor muscles, relax to allow the food in. But what's happening is the opposite. They're spasming and pushing everything out and decreasing the space available. And so it was so easy. Within a week, she was with a physical therapist. She was back to normal. And so I have a whole article on it, what to do, how to manage it, and everything. I'm just finishing it up now for next month on home cures that work.
And Cheryl, will you share about that too, about home cures that work? If someone wants to check that out, what do they need to do?
Yeah, so go to homecuresthatwork.com. Dr. Saunders has been writing a monthly article for over 15 years. I mean, think of a deep dive into his brain. That might scare him, but natural. We used to focus on a subject every month, and 4 or 5 writers will write on the one subject. Now Dr. Saunders writes an article. We have other authors, but it's dedicated to natural remedies, home cures, and it used to be a paid platform. Now it's free. You still might have to create a login to view the articles, but it is free. And you can, this month is on the big C word. Very interesting article if you check that out. And then next month, Dr. Saunders is saying he's writing an article on bloating. And, I was saying that a lot of body positive people talk about bloating happens, it's okay. And bloating's not normal. It should be dealt with. So if this is an issue you face, wait till September. Yeah.
Love it. That's fun. and good. And I feel like it's such a common thing that people talk about
Mhm.
bloating.
Yeah.
So very interesting. Yeah, I'm excited to read more about that. Okay. Quite a few of you guys on here. So this is fun. We have Edward is here, Roxy is here from Phoenix, Anne is here from Lone Oak, Texas. Peggy is here from Florida, Claire from Canada. Shirley is back. Hi, Shirley. You were here yesterday, I think, for our fixed blood sugar webinar. Sean from Missouri. Edward. Oh, it scrolled and I lost it all. See, this is what happens. It's hard to manage this. Oh, Jill's back. Okay, Marion is here. Butch is back. Hi, Butch. Terry Brown is in the house. David is here from New Mexico. Mary's here from Mississippi. Don from Alabama. Okay, so many of you. Love it. This is great. Okay. Let's see. Someone had asked what was the name of that, and that was Home Cures That Work. Did you post a link by chance in here? Yes, she did. Perfect. So there is a link in the chat. All right, we're going to go ahead and get started today and talk about our hearts. And then also, I just want to send say a reminder. Dr. Saunders is a doctor, but he is not your doctor. So please consult with your provider before you implement any of the things that we talk about today. Quick disclaimer that I have to say, by the way. So we are going to be talking about angina. And honestly, I hear this word, but I don't even know if I really know what it means. So let's dig into that. Let's talk about it. And what do we need to know, Dr. Saunders?
Okay. Angina is chest pain. It's pain in the chest. It's generally a pressure kind of pain, but people have a lot of different kinds of pain. And angina was what we refer to as heart pain. So it's not always in the chest because what's really odd is your heart muscle has no pain nerves. So when your heart is being damaged, it's not painful, except that you will feel sometimes a lot of pressure in the chest, and that's angina. Sometimes, like in the shoulder, will hurt. And you'll go, I have this terrible ache in my shoulder. Some people go like their jaw hurts, or they get a headache, or their neck, even the back. So it's not specific to one thing because people who say, I have this left-sided chest pain, that's not angina. That's not heart pain. That's the chest wall. If you can point to it and say it's on the left side, then you know it's not the heart because the heart doesn't have pain nerves. So it's all referred pain. And that's why people can have their shoulder, their right shoulder, their left shoulder, their back, their jaw, and have these unusual locations of pain that is angina or problem, heart pain. So angina can happen for a lot of different reasons. Sometimes people have viruses that get into the heart muscle and cause cardiomyopathy and cause angina. Some people have blocked blood vessels where the blood vessel has a clot and it blocks it off. And so you're not getting blood flow and the heart's not working, and then you get angina from that. So there are other reasons why you could have angina. And some people have what's called stable angina. Stable angina is where I know that I can walk 20 feet and I get to 20 feet and I'm going to start getting chest pain. So I have to stop and take a breath and everything get back to functioning. And then I can walk another 20 feet. And I've had patients that have had stable angina where it's very consistent. Most angina is not consistent. It happens randomly, and it can be sudden, like a heart attack can cause a sudden onset angina. You've never had it before, and the heart attack is a clot, blocks off your artery and stops the blood flow. And so part of your heart is not getting blood flow, or all of it would be worse. And so you're getting, severe angina. People say it feels like there's an elephant sitting on my chest and like I can't breathe. But the problem is not the lungs. It's actually the heart. So angina can show up as shortness of breath. And some people think that it's a lung problem and they have, chest x-rays and not a lung problem. it's a circulation problem from the heart, and that is one manifestation of angina.
Interesting. And I remember going to my chiropractor one time talking about how I was getting pain on the left side. I was really worried about it. And he reminded me that my stomach is actually a lot higher than I realize as well. And I have heard other people say that too. They can get weird pains in their stomach that they think could be their heart. So you said shortness of breath sometimes. What were some other symptoms that we may notice if it is
Pressure
actually
in
our
the
heart?
chest, pain in the chest. If you can point to it, generally that means it's probably not the heart, but not always. That's not consistent either. So people, they like substernal chest pain, and you can have spasms of the esophagus that feel just like angina, and you can't distinguish them necessarily. And so, yeah, other things like the esophagus, lung issues. Sometimes the heart has a membrane around it called the pericardium, and that actually does have pain nerves, and you can feel that. So sometimes it's pericarditis, or so the esophagus. Some people have like tumors that show up in the between the lungs. There's a lot of lymph nodes that can show up with tumors. And sometimes people will get chest pain like a lump and have difficulty swallowing. So
Wow,
all of that.
very interesting.
Someone posted GERD. Would that cause chest pain?
Yeah. Yeah. The acid sometimes will cause spasm of the esophagus. Yeah.
Wow. Boy, so how do you know what's going on?
Mhm.
What do we do?
How do you?
We just, it could be so many things. So
Yeah.
when this type of thing happens, especially I suppose if it's shortness of breath, that is very serious. You want to get
Yeah.
that checked out. Really,
So that's what you do, is you rule things out and to try to determine what it is. So if someone's currently having chest pain and they go to the doctor or the emergency department, and they put a monitor on them to look at the heart, do an EKG, and the EKG doesn't show any signs of abnormal electrical activity in the heart, and that's probably not. And then they draw some blood and they see if your troponin levels are elevated, and if there's no troponin elevated, then there's no damage to heart muscle. So this must be something else. And they start looking for other things. And a large percent of the time, I'm sure more than 50%, people are told they're having a panic attack. And panic attack, pressure in my chest, I can't breathe. And because epinephrine, adrenaline, causes palpitations of the heart, squeezing of the chest, that sense of I can't get enough air, and that could just be from adrenaline.
Interesting. Catherine had said, what causes irregular heartbeats?
Okay, so irregularity, we've talked about this a lot, and that's a different issue entirely. There is something wrong when you have an irregular heart with the energy system of the heart. The heart doesn't have enough energy, does not have enough mitochondria. Some of the cells are borderline on their mitochondria. They're not relaxing fast enough, or they can't make energy fast enough. There's some issue with energy. That's a different issue. We've talked about that, and that's why we have the Healthy Heart Solution Kit to help improve that energy.
All right. Anne said, my dad has shortness of breath and lost 80% of his left ventricle. I was a cardiac intensive care nurse at the time. He was shoveling snow up in Minnesota. He later got ischemic dementia.
Yeah, if you lose a lot of your heart, you become what's called a cardiac cripple, and that means that your brain is working perfectly well, your muscles are all okay, everything is good, except if you try and move, that your heart can't take the extra pressure because there isn't enough heart muscle there to pump. So you can only pump when you're totally relaxed and laying flat, so that the blood is circulating around in a circle. If the blood has to go up and down, then you can't do that. And I actually had a patient that had that. had to have a heart transplant because of that.
Jill had just said, can it be pressure in the sternum area? And I think you mentioned that.
Yeah, and there's something else in the sternum area. The sternum is a bone, and then you have a cartilage that attaches the ribs to the sternum. And that cartilage can get inflamed, just like anything. The cartilage in your joints can get inflamed. People get arthritis where they get these big, what are called Heberden's nodes in their joints because of it just inflamed cartilage. We can get the same thing along your ribs, along your sternum, and causing pain and pressure and a chronic kind of pain. Usually you'll notice though, you'll be able to push on it and go, ow, that hurts when I push on it. Whereas when you're having angina from your heart, pushing on it does not make it hurt, doesn't change it at all.
Okay.
Fun story. At one point in my life, I had an x-ray and they saw that inflammation and they said it was called Tsetse syndrome. There's, at least this is what they told me. There's a fly in Africa that's called tsetse, but it's not the same thing. But it was just inflammation kind of in the sternum, in the ribs, and then it went away.
Yeah. Yeah. It's a type of arthritis, Tsetse syndrome.
Interesting. Okay. Beverly said, I had costochondritis. Thought I said Costco. Costochondritis, which scared me about my heart until diagnosed. Pain in chest is not always heart related.
Yes, so costochondritis is the inflammation of that cartilage. So costo is rib, chondro is cartilage. So it's the cartilaginous part of the rib that's inflamed, and it's kind of like you have the sternum, and then the ribs come in, and they have to be able to move. You think about it. Think of you hold on to your chest, take a deep breath, and they're expanding, right? They're expanding, and so they have to be able to move, and so your ribs are flexible. But as you're flexing them, if they're inflamed, you're going to feel it. That's chest pain.
Okay. So Anonymous said, what's up with pain right to the right above the right breast? Mine is sometimes sharp. Don't think it's appendices or appendicitis or kidney. And sometimes, like you said, common after a few, I don't know what that word is. Sips. I usually have shortness of breath going upstairs. I've had street trits. Okay. I'm not completely understanding that.
Okay. So above the right breast would indicate chest pain on the right side. So here's the rule. This is a really interesting rule. If you can point to one side or the other, then it's not a worrisome thing in the chest as a rule. So it could be pleurisy, the pleural membrane gets inflamed inside from a virus or inflammation or something, or costochondritis, inflammation of the ribs. When you can point to one side and say it hurts here in the chest, that's not generally a bad problem. But the abdomen is just the opposite. If your general abdominal pain, if you go, yeah, it's just, I can't point to it, it's just general abdominal pain, that's just the intestines, it's not a problem. But if you can point to a specific spot and say it hurts right here, that's where you start seeing like appendicitis or diverticulitis or the problems in the abdomen. So it's kind of just the opposite. The chest pain, if you say it hurts here somewhere, I don't know, then that's a bad sign. Whereas if you can point to and say it's on the right side, just above my breast, then it's not generally a bad sign. It's all of those itises, all the inflammatory types of conditions as a rule.
Okay. Beverly said, Dr. Saunders, RDA of coenzyme Q10. I don't take statins.
Okay. I measure people's CoQ10 a lot. And, it's abundant, it's available. We make it out of cholesterol, actually. And it isn't something that everybody has to take. The reason we put it in the supplement is because the research that was done on people who have congestive heart failure, so their heart is not working, often they need extra CoQ10 to rebuild mitochondria so that they can get energy back to their heart. So it's not necessary that everybody take CoQ10. In fact, if you're taking, those who are on a statin should all take CoQ10 because that decreases the available cholesterol. So it decreases the available CoQ10. So that would be worth taking. But I know a lot of people take CoQ10, but to tell you the truth, I can probably count. I can't think of a specific instance, but I'll bet less than one hand out of thousands of people that I've tested for CoQ10 that are deficient. It's not common.
Interesting. Okay, Danielle says, what are your thoughts of bioidentical hormones? Some people say they prevent cancer and some say they cause cancer.
Okay, so here's the deal. The original hormone tests on estrogens and progestins was done in the Nurses' Health Study, and they were using artificial estrogens and artificial progestins. And these are not natural hormones. They're not. It's not progesterone. It's not estradiol. They are chemicals that stimulate the estrogen receptors and chemicals that stimulate progesterone receptors, but also stimulate other receptors and do other things in the body as well. And so these studies showed that there was a slightly increased risk of breast cancer in women who were on these hormone replacement therapies. So when the natural hormones started coming out, when they started using the natural estradiol, estrogen, and the natural human type of progesterone, all they did, the FDA just transferred all of the warnings from the xenoestrogens, the non-human estrogens and progestins. They just transferred all the warnings from that right over to the natural estrogen. So if you looked on the label, it may not apply. And in fact, research has shown that even women who have breast cancer, when they compared women taking estrogen to women not taking estrogen, it did not make a difference on recurrence of breast cancer at all. So to say it causes cancer, well, estrogens, yes, tend to cause cancer if they're not balanced with progesterone. So you need that estradiol progesterone balance, and then you need the different types of estrogens to be balanced: estradiol, estriol, and estrone. So those estrogens need to be balanced. It's called the estrogen quotient. And then the progesterone needs to be there. And that is what prevents cancer. So that's why some people say, well, unopposed estrogen causes cancer. Well, yeah, you know what? Men get prostate cancer. Is it from testosterone? No, it's because their testosterone is being made into estrogen. And it's the estrogen that's causing the prostate cancer. Estrogen is a stimulant, and it stimulates growth. It causes fibroid tumors in women. It causes ovarian cysts, ovarian cancers, breast cysts, breast cancers. So yeah, unopposed estrogen could be an issue. So that's why there's a lot of like gray area mixtures, people saying you should never have any kind of estrogen at all, and other people saying, well, you have to function, and some people can't function without estrogen. And if they put with the progesterone, then it's balanced and it's okay. So you have to go with someone who knows what they're doing, who knows what the difference between and
of that person. Deborah also said, do you have any doctor? I have palpitations, but the doctor says there's no concern at this time.
Okay, so look at it from the doctor's perspective. When we go to medical school, we're taught that we can do certain things, and this is what you do. So as like you have a regular doctor, cardiologist, and they see these irregularities in your rhythm, and they go, well, nobody ever dies from that, and we're not going to do surgery on your heart. We could give you a medication to slow it down. That might have side effects, whatever. But there's nothing to do yet. Let's wait until it gets really bad, and then we'll do something, and then we'll send you to the electrophysiologist for the ablation of your heart, where they actually kill some area of the heart so that it doesn't produce these irregular rhythms. But they do the same thing in everything. An ophthalmologist, well, you'll go in ophthalmologist, they'll say, oh, you have a little bit of a cataract. Let's wait till it gets really bad and you can't see. Then we'll take it out and put a new lens in, and you'll miraculously have normal vision. No matter what, if there's a minor problem, then they'll say, oh, it's a minor problem. Don't do anything. Let's wait until it gets bad. So what we're doing here is completely different. What we're doing here is saying, oh, you have a minor problem. That's an indication of an energy problem, for example, with an arrhythmia. If your heart rhythm is not consistent, then you have an energy problem with your heart. What is that energy problem? I don't know. For everybody, it's different. You might have a lack of oxygen. You might have a genetic problem that prevents you from making mitochondria. You might have an inflammatory condition that's causing this. You might have nutrient deficiencies, vitamin B12, folic acid, B6, B9, magnesium deficiency. All of those can do it. You might have a toxicity. You might have lead or mercury. There are so many possibilities of why you might have an energy problem that's where you search for next. All the heart arrhythmia does is tells you there's a problem. Okay, where's the problem? Energy. Wow, that's a long list of possibilities. Okay, so how do we figure out what it is? Well, let's do some tests and find out. Is there toxicity? Is there deficiency? Do you have genetic abnormalities? Do you have inflammatory conditions? And do you have lack of blood flow or lack of oxygen, anemia? Just go through and test for each one of them. And that's the way to deal with it. So in medical school, we don't learn that. That's not even an option. So don't try to go to your doctor and negotiate and say, well, I want to look for the cause. It's going on. Your cardiologist says, I don't even know what you're talking about. That doesn't make any sense because it's not bad enough to worry about at this point. You're not going to die at this point.
Wow. Again, I know we're going to get some questions about this. Where do you find a doctor like Dr. Saunders then, right?
Yeah.
And
functional medicine doctor.
You don't. No, just kidding.
Yeah. No, yeah. Look for a functional medicine doctor. There's a lot of really good ones out there. I just read a book by Dr. Means in Oregon or Washington, who does everything I do. I totally agree with her.
What was the name of that book? It's something Good Energy.
Good Energy, yeah.
Okay.
Yeah.
But yes, we mentioned this. Just Google functional medicine doctors in your area. That's kind of what we'd recommend if you're really looking for someone.
Yeah, and if you find someone and it's not a good fit, ask them because they all know each other. I know all the functional doctors in town, and we talk, and so I refer people to the other guys.
Awesome. Okay. Roxy said, I would like to know how to get off my blood pressure medicine. I don't want to take this for the rest of my life.
Okay. Don't want to take it is one thing. Don't need it is another thing. So if you say, I don't want to eat spinach, then I would say you should probably eat spinach anyway. But so as far as the blood pressure medication, most of the time you don't need blood pressure medication. Most of the time it's not even necessary. What you need to do instead is to say, why is my blood pressure high? Ask the question. And so if you go to your doctor that prescribed the medication and say, why is my blood pressure elevated? And then you can look up. Actually, AI is really helpful. I've used AI a lot. What are the possible secondary causes of hypertension? You have to look up secondary causes of hypertension. So then the AI will give you a list of things, and you just print that list, bring it to your doctor, and say, which one of these do I have? And really, because everybody has secondary hypertension, there's no such thing as primary hypertension. That is not even a thing. You wouldn't be living if that was the case. So because you're still alive and you're still breathing, then you have high blood pressure, there's a secondary cause. So find it. And that's where you go. So you go through this long list. You go, okay, I don't have any deficiencies. I don't have toxicity. I don't have any brain problems. My kidneys are okay. I don't have diabetes. So you just start crossing them off. Not that, not that, not that. Okay, so here's a list. We got to test for these things, and then test for them and find out what's going on, and then fix that problem, and then you don't need the medication anymore.
Awesome. Tony says, first of all, welcome back, Tony. I'm off my blood, excuse me. I'm off my blood pressure meds. I needed to monitor my levels for 1 month and then made the appropriate adjustments to my diet, low carb, exercise, prayer, and meditation brought it down to normal. No more meds for me now.
Yeah, modern lifestyle is a big deal for Tony. Tony, I appreciate that because I didn't mention that. But, if you were to take high blood pressure and just take modern lifestyle, so the stress, the way we eat, the diet, the sleep or lack thereof, just the way we live our lives today, and you change it to you optimize your lifestyle, I think easily 80% of people with high blood pressure would be normal.
Wow, think about that. It's a big deal.
And can you comment? There was a couple questions about, if you can't go to a functional doctor because of Medicare, what would you tell them?
Yeah, most functional doctors don't take Medicare. Medicare doesn't cover what we do. They don't like to cover what we do because we test a lot and then we take people off medications, and they don't like that. So, so then what you do is you have so many resources yourself. I had a doctor at the VA hospital. The VA says, we are not covering anything you do, but he was a VA doctor and that's what he did. And so he continued to do it, but they wouldn't do his tests, the tests that he wanted to do to find out what's the underlying cause. So he started out all of these veterans on just those three things that I was talking about: their diet, their exercise, and their stress levels and their exercise, sleep. And so he would put them on a good circadian rhythm for sleep. They would start a regular exercise program. They'd do stress reduction things, meditation, prayer, singing, writing in a journal, all those things. And then their diet would be a low carb kind of diet. And what he said was that their annual physical that the VA did pay for, their numbers came back normal. They felt better. They did better. And that's all he did. So, the majority of the time, that if you manage those things, those just the basics of life, you may not need to do all that testing and everything.
All right. Okay, so Mary, kind of a follow-up question about estrogen. She says, should you take estrogen if you have had a total hysterectomy?
The answer is maybe. So if you need estrogen, then yes, you can take estrogen. A total hysterectomy means they've removed your ovaries as well, so you're not you don't have any ovaries to make estrogen and progesterone. You still make estrogen and progesterone from your adrenals. So the adrenal glands put out these hormones, and then your peripheral fat makes extra estrogen. So if you have an adequate amount of estrogen and you're not having symptoms and you're feeling okay, you're sleeping okay, you're not getting hot flashes, your brain is functioning well, then you may not need estrogen replacement. So there isn't a one size fits all with hormones. Hormones are not about levels. Hormones are about balance. And so if you balance them up here, that's good. If you balance them down here, that's good. If they're imbalanced, that's not good. If they're imbalanced the other way, that's not good either. So you have to look for balance. And if symptomatically you're not having any of those issues with hormone balance, then you may not need any extra hormones at all.
For someone who's having, maybe some mental health issues and they've had a full hysterectomy, is that something you would check right away as hormones?
Definitely. The first test I do would be inflammatory markers, metabolic markers, hormone markers. Yeah, I would just automatically do those.
Yeah, I'm just always surprised at how different doctors do things so different. It's amazing.
It's interesting though. When I was in medical school 30 years ago, we were told that anxiety symptoms have nothing to do with hormones, that women going through menopause are just hysterical and you have to give them Xanax or drugs, and it's not a hormone problem. And so 20 years later or so, it's been 10 years, so 20 years later they're like, well, actually all of these panic attacks and anxiety is related to a lack of progesterone. It's actually a common thing, and estrogen progesterone imbalance. So it changes over time what the recommendations are. So I think working with individuals is a better way than having a blanket recommendation for everybody. What does this individual need? What does this individual have?
Sure. All right, good stuff. Let me get back up here. Okay, Mark says, can you cover what to do to help with a high calcium score from plaque around the arteries?
Okay, so a high coronary calcium score, it indicates that you have clots that have formed in your arteries of your heart, and that those clots have organized and they have calcium deposits in them. And why is that important? That's because that tells you that you have an issue with fixing your blood vessels, because we all get damage to our blood vessels. That's like a normal process. It happens to every animal, every creature on God's earth gets damage to their arteries. So if you have a high coronary calcium score, it either means you're having excessive damage or you're not resolving that, you're not healing that very well. So to find out the next step, and this is part of what the Healthy Heart Solution Kit is about, is how to find out which it is. So if you have inflammation and you're creating extra clots, and you have damage to the inside of your arteries because of toxins or dietary problems or metabolic problems, then that's one thing to deal with. If you have high lipoprotein A that prevents you from absorbing and dissolving those clots, so they organize and form calcium and harden arteries, then you have to deal with that issue. So dealing with the issue, the underlying cause, is really the reason. So the good thing about the coronary calcium score, it says you have a problem before it becomes a problem. Remember, in medical school, we're taught wait until it becomes a problem. And we're saying just the opposite. No, these indications are that you have a problem, and start dealing with it now so that you don't get angina, heart attack, bypass surgery in the future.
It's like the check engine light has gone on.
Yeah, I love that.
Before it breaks down in the middle of the road, middle of life. Yeah.
Yeah. How long do you want to ride around on that thing, not knowing what's going on?
Right.
All right. Frank says post stroke on diabetes reversal, phase 1, day 84. Last 3 weeks, fasting glucose between 4.5 to 5.2, down from 9 plus. Last 5 days, consistently 4.5 to 4.8. Going on vacation, can she go on to phase 2 now? Also, she is off all meds, including blood pressure meds. Her blood pressure is 103 to 126 over 65 to 81 with a pulse of 75 to 89. However, in this last week, the blood pressure has been good, but her pulse is 91 plus, up to a blip at 100. Is there a need for concern? Could this be a sign of anemia, as we have had to keep her protein on the lower side of times 1 per kilo of body weight? There's a lot of questions after that also, so let's start with that.
Okay, so that's you've done amazing things. That is really good. So post-stroke, the blood sugars were way high. For those of you in the United States, his 200s consistently, blood sugars in the 200s have come down now under 100. The number between 4 and 5 is a really optimum place to be. And so bringing the blood sugar to normal, great. The fact that the blood pressure is normal is a very good sign as well. And what that means is the brain is no longer starving for oxygen or glucose. Often it's glucose when somebody has hyperglycemia. So the brain's not starving, so it's not raising the blood pressure. Remember, that's why the blood pressure goes up, because some organ in your body is starving for something, some nutrient that they need. And so the post-stroke, for your blood pressure to come down to normal off the blood pressure medications means that you've done really well. So the question is, can you move to phase 2? Well, absolutely. The indication was that consistent number between 4.5 and 4.8. That indicates it should be between 4 and 5, and that tells us that you have a normal blood glucose. And just keep monitoring on phase 2, just like it says in phase 2. Keep the monitor on and look at what the numbers are, and you'll see when the glucose starts going up because you had, I don't know, chips and salsa or all this,
Bread.
all the carbs that I want: beans, peas, lentils. But and we've had people really surprised that they tolerate bread and don't tolerate what was it, nachos. So going on phase 2 then is the part of the learning process of, oh, I can do this, but I can't do that.
So Frank, I'm assuming this is for Pat, right?
Yeah.
You didn't say that, but I think you said, I
That's what
just
it
know
sounded
that
like.
it's usually Frank and Pat that are usually on here. So, okay.
Yeah.
And then what was the other question here? Oh, they were just kind of wondering if it could be a sign of anemia. Would blood pressure go up? Okay.
No. The blood, it wasn't the blood pressure, it was the pulse goes up. So the pulse goes up when you need more blood flow. And so if you go out and run a mile, then you're going to need more blood flow. Some people, when they're a little dehydrated and they're not getting enough blood flow, just going from sitting to standing is enough to make their heart rate go up. And that's called orthostatic hypotension, low blood pressure. So consider the causes of dehydration. So we have this whole webinar on dehydration that we discussed it in detail, but I'll just give you briefly now. There are 3 causes of dehydration. One is a lack of water. Another is a lack of sodium, salt, and another is a lack of potassium. The most common is lack of potassium, because it's hard to get enough potassium if you're not living on fruits and vegetables. It's pretty easy to get enough sodium, but I have had a lot of people lately deficient in sodium because they're drinking too much water. So they're told they should drink a gallon of water a day. And that gallon of water has to have enough salt in it to keep your sodium levels up, because that's what keeps your blood volume up. If you don't have sodium, you can drink all the water you want, and it's totally worthless because your kidneys will just squirt it out. And so you're going to be peeing all day long and you still will be dehydrated. So it's imperative to get enough sodium and not drink too much water to deplete your sodium in order to maintain your hydration status.
All right. Oh, I had another question here I was going to ask. Okay, there was another question with that. Okay. Also would like to add in a small amount of protein supplement, but has ribodioside M as a sweetener. Is this okay for phase 2? Taking Nervalo, Synachroma, berberine, nattokinase, omega, and other supplements.
Some people do not tolerate artificial sweeteners at all. Yeah. What was that guy? Let's say that guy that could eat like breads and cereals and stuff, but he ate some gum.
Juice.
What?
Could drink juice.
Yeah.
But not sugar-free gum.
Yeah. Isn't that interesting?
The juice had real sugar in it, I think, but that sugar-free gum just was a disaster. So I just find that so interesting.
Yeah. So be careful of sweeteners. Could be an issue.
All right. Beverly says, I have shortness of breath due to inflexible ventricle from years of high blood pressure and the high blood pressure meds. The only thing I can do is keep in condition to mitigate it.
Yes. That is so important. And I don't know, the high blood pressure meds do decrease the function of the heart over time, especially the beta blockers. So yeah, you may try a different way. Try finding the cause of your blood pressure is high. And then yes, exercise is so important for the heart, and I haven't mentioned enough of exercise, and that's so important.
Okay. Jill said I had a 97% blockage last year and had a stent put in. How will I know if I have another serious blockage? I was told no way to know unless I get symptomatic again. Is there a routine test or a way to know if a blockage is building up again?
No. No, there isn't a routine way to know. It would be catheterization to look at the caliber, how wide open that place where the stent is. But the fact that you had a stent, that you had a 97% blockage is already telling you, okay, there's an issue. Let's deal with that so it doesn't become a big problem. And that's what the Healthy Heart Solution Kit is about. The problem is not cholesterol. The problem is clots. So what you want to do is prevent clots and resolve clots. So like one of the things that you should have is tests to see if your clotting mechanisms are messed up, if you have excess inflammation, or if you have high lipoprotein A, in which case you're not going to dissolve clots well. So you're going to have to use something like nattokinase or lumbrokinase, which are clot dissolving supplements. That they're enzymes, so they're natural. So it's not a prescription, and those dissolve clots so that when you do form clots, you'll be able to dissolve them.
Anonymous said, if you've just been told that you had an irregular ECG and that you need to meet with the anesthesiologist before proceeding with prostate surgery, what are the possibilities?
It's an energy problem. So an abnormal ECG means you have an arrhythmia of your heart. There are a couple of other things. You might have normal rhythm and have an elevated wave. One of the waves, like the ST wave, it can be elevated, or there's something called R wave progression that indicate that there may be some damage to the heart or some dysfunction of the heart. In any of those cases, the abnormal ECG is an electrical abnormality, and the electrical part of the heart is the energy part. That's what the heart is doing when it's contracting. And so what you want is to have normal energy function and to restore the normal energy function. So that's what the healthy heart solution is about, is how to restore. Part of it is how to restore that healthy heart.
And we'll share more about how to get that in just a moment. We're going to run out of time. But Barbara says, does an excess of mucus, for example, every day, even night clearing, a real health issue or heart or any health concern? What can I do to stop this irritating occurrence?
Okay, mucus comes from cells. There are mucus cells that are in your in the lining of your whole respiratory tract all the way down, and the mucus protects you. You need it. It's there for a reason, and it's perfectly normal to make mucus. Some people make more than others. If you don't make mucus, then you get a lot of other problems like inspission or cystic fibrosis, for example. They have problems with mucus, and they have to take cysteine in very high doses, NaC, so that they can thin the mucus out. They don't get mucus plugging. So you need a sufficient amount to be able to clear all of the junk that you're breathing in every day out of your lungs and out of your respiratory tract. But then there's the other side of the line of there's too much. I'm chronically congested. So that is irritation of the lining of your respiratory tract. And that irritation could be allergies. It doesn't have to be allergies, though. It doesn't have to be an allergic reaction. You can have irritation from smoke or from pollen or from dust or dust mites. Yeah, that's usually allergies. Or any kind of irritant that some people react to and not everybody does. So for example, in smog, there's a certain amount of nitric oxide, and that can dilate your blood vessels and cause you to make more mucus. And there's a certain amount of ozone that's in the air from smog too, and that's what causes irritation in the lungs. And that could be irritating, but not an allergic reaction. So distinguishing between what's causing this irritation if you have excessive mucus versus an allergic reaction, because a lot of times it's mild allergies, pollens that you're reacting to, dust mites, anything.
Okay. Final question. Can unstable angina cause vision problems?
Okay. Unstable angina can be related to vision problems. So unstable angina, we talked about stable angina where I can walk 20 feet and I'm going to get chest pain. And then I have to rest, and then I can go 20 more feet and I get chest pain. I can rest. Unstable angina is I can walk 50 feet and it'll happen. I can walk 5 feet, it'll happen. I can walk a mile and it'll happen. And it's not stable, but I am getting angina. So unstable angina is an entirely different problem. That is a constriction of blood vessels. So it's a spasm of the artery that stops the blood flow. And yes, you can have spasms of the artery anywhere in your body. And so vision changes are often happen with, for example, a migraine headache, which is just a spasm to the arteries in the brain and slows down the blood flow in the brain. And when the retinas are not getting enough blood flow, they are super sensitive to blood flow. So any tiny change in blood flow in your retinas, you're going to notice it. Your vision is going to change. So yes, they could be related, but it's not because of the angina. It's because you're getting spasms in your arteries.
Very interesting. Thank you, Dr. Saunders, so much for this webinar. This was really, really good. We'll see you next week. Go bless your patients.
Yes, bye.
Thank you all for being here as well. I just want to mention that you can go to bartonwebinar.com and you'll find links to our YouTube channel where we have all of the replays for these webinars, links to our supplements, as well as the Healthy Heart Solution Kit. So use code webinar25, that's one word, and you will save 25%. So really good deal. Okay, I think that's it. Thank you, Cheryl.
Thank you. We had such good questions today. I feel like we always have good questions, and there's so many more. We could have been on here for another hour with these questions.
I know these were really good. Come back next week, you guys. Post them in the Q&A right away, and we'll get to as many as we can. Thank you.